everybody. I am Dr. Ashok Baraiya, E.N.T surgeon. I have a 10-year exposure for E.N.T side. I work 10 year in E.N.T डिपार्टमेंट. चार साल मैंने यहाँ की सिविल हॉस्पिटल है भावनगर की सिविल हॉस्पिटल में काम किया है और 5 साल से मैं प्राइवेट सेक्टर में प्रैक्टिस कर रहा हूँ. अभी मेरा 2 जगह पर सेटअप है. एक भावनगर में राम मंत्र मंदिर के बाजू में जयरामगिरी हॉस्पिटल करके है, वहाँ मैं काम कर रहा हूँ. दूसरा मॉर्निंग में पीएनआर सोसाइटी में पीएनआर हॉस्पिटल है, वहाँ वर्क करता हूँ. मैं आपको एलर्जिक राइनाइटिस के बारे में बताऊंगा कि एक्चुअली एलर्जिक राइनाइटिस क्या है. एलर्जिक राइनाइटिस इज द रिएक्शन ऑफ एलर्जिक एंटीजन एंड एंटीबॉडी. दिस लीड टू patient develop many of symptoms like rhinitis, nasal blockage, sneezing, eye watering, eye redness. Even sometimes there is a ear problem is also. So allergic is mainly due to is now time there is a many of pollution. This lead to patient got allergic rhinitis. In general practice, every 10 patient there is a 2 or 3 patient is allergic rhinitis. Even small side having a allergic rhinitis, and then every time is exposed to allergen, then more and more episode of allergic rhinitis patient may develop. Allergic rhinitis is initially the pathophysiology is there is a antigen and antibody reaction in nasal mucosa may lead to allergic rhinitis, and then patient develop symptomatic all type of running nose, nasal blockage, sneezing, watering of both eye, redness of both eye, itching all over nasal side and oral cavity, and ear itching. All these are symptoms due to allergic reaction. In allergic rhinitis there is a maximum problem is if patient living in city. There is a maximum due to pollution is the main responsible factor, and dust, and in time in general day to day the seasonal allergic rhinitis. There is a even change in season may lead to patient have developed many more of symptoms of this type of. Patient have a long time of allergic rhinitis may develop allergic polyp, इथमो नेजल पॉलिप बोलते हैं, जो वो डेवलप होता है. इसकी वजह से पेशेंट को बहुत सारा प्रॉब्लम होता है. इसकी बहुत सारी कॉम्प्लिकेशन है. हर बार इसको नेजल ब्लॉकेज, रनिंग नोज और वो सब प्रॉब्लम रहता है. साथ में ईयर में भी प्रॉब्लम डेवलप होता है. ईयर में सिक्रेटरी ओटाइटिस मीडिया बोलते हैं, वो भी होता है. इसकी वजह से पेशेंट को हियरिंग लॉस होता है, कान में टिनाइटस बजता रहता है. और इवन लॉन्ग टाइम देयर में भी रिपोर्ट पेशेंट डेवलप एलर्जिक bronchial asthma also. So many times allergic rhinitis is very dangerous. In day-to-day practice we follow every 10 patient there is 1 or 2 or 3 patient have a allergic symptom, but patient is not taking proper hygienic preparation, not take any medicine. This may lead to allergic nasal polyposis, and allergic rhinitis lead to bronchial asthma also. In mainly the allergic this type of allergic nasal polyposis, mainly the treatment is the first time is the surgery. बोलते हैं functional endoscopic sinus surgery. We remove all polyp and patient he may survive lifetime. He take antihistaminic and Montelukast also. These are the main medicine in effective in patient with allergic nasal polyposis. Even patient of allergic rhinitis may require lifelong even antihistaminic and anti means Montelukast also there. Even patient have any seasonal changes, patient develop symptomatic this type of all type of symptom, and it lead to the repeated episode is disturbed to his life also. Sometimes there are allergic rhinitis may lead to SOM, secretory otitis media. Secretory otitis media may lead to sometimes there are operative procedure is required. We do routinely laryngotomy with grommet insertion. Sometimes there is a long standing of this SOM may lead to SN loss also, and patient is deaf sometimes there is require hearing aid, sometimes their patient have chronically become tinnitus. This may lead to patient is depression and anxiety, all type of symptom may lead to allergic rhinitis. All this type of allergic rhinitis lead to all many complication in ENT side also, and lifestyle changes also. There is a allergic rhinitis. Allergen is the mainly many of the allergen, but common allergen is dust mite. We all see the all time if there is a dusting this type. This dust mite is come in contact. The patient may this work as a antigen. Body develop antibody, then lead to allergic reaction. Sometimes there is a pollution, cosmetic, and spray. All type these are lead to allergic rhinitis. In summer there is a pollen. This may lead to also allergic rhinitis. And some complication of allergic rhinitis, patient after 30-40 year of allergic rhinitis may lead to allergic bronchial asthma. This patient is very sensitive to allergic content, then develop breathlessness and difficulty in breathing, chest ghabrament, all type these lead to breathing difficulty. And sometimes it may be patient not take any treatment in during of acute exacerbation, then patient develop even severe dyspnea and chronic heart failure also. So allergic is very dangerous in life-threatening condition also there is. We treat all type of allergic reaction or all type allergic symptom in as early as possible. So we can manage properly, we can not lead to future complication of this. We commonly use the antihistaminic medicine and also Montelukast. We are working very well, patient may feel very better. In medicine there is a some of anti-allergic group in higher grade generation 3-4. There is a fexofenadine Montelukast combination is very well working. Patient have regular take one OD dose can improvement all symptom of allergic rhinitis. Even patient of bronchial asthma, allergic bronchial asthma, patient take single medicine of fexofenadine and Montelukast, he have a very improvement of life. Acute exacerbation of acute asthma is also improved. There a reduced episode of this type of asthma. Patient of having multiple time of allergic polyp. We one time even operated, patient not take any medicine, not keep any regularity, may lead to recurrence of ethmoid polyp, allergic polyp. This also requires sometimes surgery, repeated fast, and antihistaminic also. But patient has a antihistaminic and Montelukast combination is the very well working. We patient advise or you take every time one tablet in lifelong, you improve all type of life-threatening complication, and also these are the comorbidity also we all type of complication due to allergic rhinitis may be improved. Patient not required any repeated surgery, not required any medicine, not admission, not even IV injectable, or all type is boring treatment is if patient take regularly antihistaminic and Montelukast also. All these are related to allergic rhinitis. Sometimes there is patient develop secretory otitis media. It is a very common complication in patient of allergic rhinitis. Even patient is single episode, if patient not taking treatment 5 to 7 days, he develop secretory otitis media. Secretory otitis media is lead to sometime hearing loss, sometime chronic tinnitus. These are very complicated. Every time patient is come, sir मेरे कान में कुछ बज रहा है, कुछ बज रहा है, कान में कुछ सर्दी भर गई ऐसा लग रहा है, कान में सुनना बंद हो गया है, वो सब है वो एलर्जी के रिलेटेड ही प्रॉब्लम है. तो इसमें आप रेगुलरली मेडिसिन रेगुलरली आप प्रॉपरली ध्यान रखोगे तो भी फ्यूचर में कॉम्प्लिकेशन नहीं हो सकता. इज प्रिवेंटिव ट्रीटमेंट. इफ पेशेंट हैविंग एलर्जिक राइनाइटिस और ऑलवेज यूज मास्क. Even in dusty environment, you traveling, all time you use to wear mask. Mask is very important. It prevent some routine allergen to go inside the airway tract. So it prevent very well in allergic rhinitis. Sometimes cold is avoided, all type of allergic management. We have also one paper is also there is for allergic rhinitis. We commonly give patient. We advise sometimes patient is a nasal spray. These are very important nasal spray because nasal spray is also steroid spray is also important for that. But we have commonly advised this nasal spray also in allergic rhinitis. So we prevent both combination of steroid spray and nasal antihistaminic and Montelukast also. We advise patient regular you take nasal spray and antihistaminic Montelukast. You prevent many episode of allergic rhinitis. You may improve lifestyle also. Sometimes there is a medicine also. There is a all type of antihistaminic available, but new generation of antihistaminic is very properly working. Sometimes there is a first generation medicine like Avil, chlorpheniramine. These are the very sedative. Sometimes patient may bother take one tablet and say aside, सर मेरे को तो पूरे दिन नींद ही आया, तो इसमें वो ज़्यादा इफेक्ट करेगी. इसके बाद में लिवोसेट्रिजिन आई है, इसके बाद में फेक्सोफेनाडिन आई है. तो फेक्सोफेनाडिन का बहुत रोल है. वो नहीं कोई साइकोटिक एक्टिविटी नहीं रहती है, सिडेशन कम हो जाता है, पेशेंट को एंटीजन एंटीबॉडी का रिएक्शन जो है वो बहुत कम रहेगा. तो ऑल टाइप ऑफ न्यू जनरेशन ड्रग इज वेरी वेल प्रॉपरली. Patient is develop all type of this type of complication may be preventable by this type of antihistaminic and all type of medicine. Then allergic is the preventable disease. You properly take care, take regular medicine, regularly you properly guide. Then is the misnomer. No any complication develop, but you properly take any medicine, regular follow up, regular this type of medical advice. This lead to all type of improvement.